Hi everyone, I'm Dr. Z. I'm a clinical psychologist specializing in transgender care. Welcome to my channel. If you have not had a chance yet to subscribe, please do subscribe. I very much appreciate your support. Not only are you supporting my content, but you're helping so many other people find this content because, as we know today, algorithm on YouTube is a challenge. So I would very much appreciate and be grateful if you subscribe, like this video, and comment on it as well. For this video, I want to share with all of you what are the three subtle signs that you might be a trans woman. A lot of times we talk about signs that are more overt, signs that are more easily to spot. For example, early childhood onset of gender dysphoria starting in early age, with the narrative of a little boy wanting to be a girl that continued and progressed into post-puberty where the child still wanted to be a girl, engaging with stereotypically girly activities, continuing into young adulthood, presence of physical dysphoria that may be mild to severe, where a person is deeply uncomfortable and feel disaligned with their primary and secondary sex characteristics, so on and so on. You get the idea. And this type of clues are great in a sense that they help a lot of you to really solidify your sense of identity and not to question it so much. But what happens when you may be in a deep denial or you may be experiencing a lot of gender repression? And as a result of that, the clues are very subtle. And because they're so subtle, you have a hard time really understanding how they may collectively create a bigger picture. And when the clues are so subtle, you're left much more in confusion because the clues are not so black and white, right? When you don't have a narrative of, I always known I wanted to be a woman, and your clues are very, very subtle on a daily basis, how do you know if that's really what they're telling you? If you're also working with a therapist who doesn't have experience in gender, there's pretty high chance that they will not spot this very subtle clues because it will not be on their radar, which will further lead into confusion. If you work with a therapist, gender knowledgeable otherwise, that is still clinging to dogmatic ways that to identify the trans woman, you must have strong hatred toward your primary, secondary sex characteristics. You must feel like you are a woman trapped in a man's body. And are you sure you are a trans woman because you don't look like you're feminine enough? The dogmatic crap. If they're sticking to dogmatic understanding of presentation of gender dysphoria, boy, they're really missing out on giving a lot of individuals clarity. So subtle presentations of gender dysphoria can be very difficult to spot, especially for a lot of trans women or for a lot of individuals who tend to feminize and have a strong feeling that they may be feminizing for other reasons. Sexual is one of them. Another common one is just to feel sense of peace, or just because it feels good. It can also be very confusing not to spot the signs. Now, again, I have videos on feminizing/cross-dressing. Not everybody who feminizes or cross-dresses is a trans person or immediately identifies or goes on to experiencing gender dysphoria. So I just want to be very clear here. But let's talk today about three very main, very subtle signs that you may experience that if any of them are something you're experiencing, I want you to start paying attention to them. I want you to start journaling, writing about them, take them into your therapy room, discussing them, dissecting them. Start paying attention to them because chances are they're trying to tell you something, and there's a higher chance they're trying to tell you something about your trans feminine identity. So the first subtle sign is you may suddenly experience yourself out of a blue having a thought, entertaining idea of thinking to yourself what it would be like to live a life as a woman. Now, this might just start as a pop-up idea that comes out of nowhere. You could be watching a film and it may bring this idea to life. You may be having a conversation with a friend and somebody asks you about it, or you just may have this thought pop up out of nowhere. Now, of course, having thoughts, entertaining ideas of what would it be like to live a life in a different gender is natural. People have them all the time. Doesn't mean anything. It's also contextual. You're a writer, for example, and you're writing a book, and your protagonist is a woman, and you want to try to get into a sense of what it's like to be a woman. You may be entertaining the thoughts. You're an actor, and you may be playing a female role. You may be entertaining the thoughts. Again, it's contextual, right? That's a different story. However, if out of the blue you have the thought, still fine. But, and here's the but piece to the subtle clue. If this thought doesn't go away, but starts to persist, and you start to find yourself entertaining the thought more frequently, every day, several times a week, now it's been 5 months, you're still thinking about what it's like to live a life as a woman. You're finding yourself now imagining perhaps what it's like to live life as a woman, what it's like to be referred to as a woman, what it's like to present as a woman. And the thoughts may be preoccupying your mind when you least expect it. Maybe you're at work or at work meeting and you find yourself daydreaming into the thoughts. Or maybe it's at the dinner table and you're starting to think about the thoughts. When you find yourself experiencing the thoughts more consistently and there's persisting element to them, that is telling you something. That is starting to now showcase that the initial thought is like a thread from a sweater. It's connected to something bigger. And it's trying to unravel that for you so that you're paying attention to it. Again, entertaining thoughts of what it's like to be a woman is totally fine, but having them persistently going on, there might be something else that it's telling you. So the first subtle clue I want you to think about is, do you suddenly find yourself entertaining thoughts of what it's like to be a woman, what it's like to live a life as a woman? And by this time, you may not have any physical dysphoria. You may feel, most likely, if you actually are a trans woman, you're most likely going to feel neutral about your assigned gender. Your most likely narrative is going to be, I don't really hate being a man. I don't really hate having a masculine body or masculine characteristics. I don't also love it. I feel neutral about it. There's going to be an element of neutrality to it. So it's physical dysphoria, like I said, is still not going to be present. It's all just going to start cerebrally for you in your head. You may be even wondering, where do the thoughts come from? Why am I suddenly preoccupied with it? You may even go so far as starting to research this. You may start questioning your sexuality, by the way, even though gender sexuality not necessarily connected, you may still question, could it possibly be that I'm gay? You may wonder if you're a feminine man, and that's why you're having the thoughts. The thoughts are going to be there, and it's like a door. Once you open it, you can't close it. It's like Pandora box, many of you say. It's going to be there because that thought, like I said, is a thread that is connected to something, and it's for you to figure out what that something is. So that's the first sign that you might be trans woman. The second one, and by the way, if you have all three of the subtle signs, please really pay attention. They're telling you something. Things in our lives are, again, knocks on a door. They're knocks on a door because there's parts of us. And if we're not really living out our our authentic essence in any shape or form. Gender, what we're meant to do for a living, who we're meant to be with, how we're meant to navigate our life. We're going to have the signs that are going to bombard us until we get into alignment, until we get on a path we're meant to be on, right? Same thing here. The second subtle sign now has to do with the physical aspects. Now, you may still feel neutral and not just neutral, maybe you don't even care about male secondary and primary sex characteristics. But now you're starting to have thoughts about not just what it's like to live a life as a woman, but now you're starting to have thoughts of what would it feel like if I had female secondary and primary sex characteristics? What would it feel like if I had longer hair? What would it feel like if I had breasts? What would having breasts feel like? What would it feel like if I had curvier body? What would it feel like if I had hips? What would it feel like if I had female genitals? So you start now going from just what it's like to live a life as a woman to now what it's like to embody physically, right? Physically step and embody the physical attributes of a woman. Now, these thoughts of wanting to embody female attributes may then start to waken up gender dysphoric distress signals. And for somebody who is in repression or in denial, and most likely, if you're having subtle clues, you probably are. What happens is you go from feeling neutral about your body to suddenly starting to notice things you never noticed before. For example, wow, I never realized how much I actually dislike having facial hair. Or, wow, I just now realizing that when I come out from a shower, I have a hard time looking at myself completely nude in a mirror, even though I think I have a nice body. Or, wow, during intimacy now, I feel uncomfortable looking at my genitals. Suddenly, you went from neutrality to a very mild discomfort. And you may even have things pop up from the past, from your past histories, that suddenly you're looking through this lens of, wow, I never noticed that was actually a discomfort. Wow, I never noticed now. I actually don't like this primary and secondary sex characteristics of being a man. So that's another thing that is a subtle clue, right? So not only are you entertaining thoughts of what it's like to have female body now physically, especially breasts, genitals, hips, but you're also now starting to question and starting to really connect, perhaps for the first time, how you truly feel about your physical attributes. The third subtle sign is going to be for all of you watching who tend to feminize. You may call it cross-dressing, because for you, you strongly feel that you're cross-dressing solely because it feels good, solely because it's only for sexual pleasure, which, by the way, nothing wrong with that. I don't hold the view that it's like not okay to do that. I think it's totally fine. Or you're feminizing / cross-dressing because you feel a peace of mind. Or maybe it's just because you like it. Whatever your reasons are, you are in a camp of individuals who engage in this activity, engage in this behavior of occasionally or more often or frequently expressing yourself in privacy to yourself in some kind of women's clothing. Maybe it's a whole hyper feminine look. Maybe it's very mild. Maybe just wearing women's panties underneath your clothes. It could really range. Range could be really wide. And whereas before, when you were feminizing and cross-dressing you you were able to compartmentalize it. You were able to tell yourself that I'm only doing it because A, B, C, D, whatever your reasons may have been. Now you're finding yourself questioning, could I be engaging in this behavior because I am transgender? Could I be enjoying when I come home from work, getting out of the clothes and putting on a feminine silk robe and really loving the feel of it, loving the feel of the silk on my body, loving going about in the privacy of my home, making myself meals, sitting down, watching a TV, the peace that I get, the tranquility that I experience. Could that be because I'm actually a woman? So you're starting to now look at the behaviors that before you had a very strong compartmentalizing justification for it. And now suddenly you are starting to question it. And the more you're questioning, the more you may be noticing other things. Again, it could be you're starting to notice maybe you feel differently now about your body. Your physical elements of dysphoria might come up. You might find yourself starting to obsess with the search for meaning by going on internet and Reddit and Discord groups and other type of groups and searching for meaning, reading people's narratives, and especially when you read people who say, "Oh yeah, I thought I was just a crosser too, but it's turned out that I had a repressed trans women identity." You may feel anxiety and a state of fear that this could be you. Notice how it would have gone from feeling totally fine about activity to now not feeling totally fine about activity because, oh my God, this could be telling something else about myself. So this is another third subtle sign for those of you who do tend to engage in some kind of gender bending behavior in terms of clothing. These are the three very subtle clues that I find most common. I'm sure there's a lot of other subtle clues. Do they all mean if you have them, you are a trans woman? For sure, of course not. Nothing is so black and white. What I found is that people who have one or two or all of these elements, like I said, it's a sweater that is unraveling and it leads to something. And a lot of times it does leads to people's inner identity is a transgender woman, and there is a lot of resistance. There's a lot of internalized transphobia. There's a lot of pushback in acknowledging that because it is scary, and especially for a lot of people that already have families, who already have, like I always say, your ecosystem in place, it is going to be even more scary because there's going to be a fear of losing all of that. So I completely understand why there would be a denial in place and a depression taking place of not wanting to get to the truth because it makes complete sense. So these are the three subtle signs. Comment below, let me know if you had or have any of the subtle signs, what they might be telling you, what other things you might notice, what other subtle signs you may have had. Comment below. I love listening, hearing all of your comments, and I will see you all next time. Goodbye.